Joining us this morning from Gundersen Health System is Dr. Ben Parsons. Thank you for joining me.
Thank you for having me.
So a lot of people blame smoking for lung cancer, and while that is a huge factor, there's other factors that people might not think about. Can you kind of explain those for us?
Yeah, well, smoking is a risk factor for lung cancer and many other cancers. Things like radon, which is a radioisotope that's released from the Earth's crust, is actually also a risk factor for lung cancer, and that's an odorless and colorless gas that we encourage people to be screened for in their homes, especially their basements. And there's home testing kits that are actually quite cheap. If you think your home has not been screened, we would encourage that. And people who do smoke, we have great programs to help people quit smoking. So things like counseling, medications, and even things you might not think about like acupuncture or hypnosis have been helpful for quitting smoking.
And like you said, screening is available, but usually for those high-risk individuals. So who does that apply to specifically?
Yeah, so lung cancer screening is with a low-dose CT scan, and that is generally for people ages 55 to 75 who have significant risk factors like a long-term history of smoking. So if you're interested in learning more about CT scan screening for lung cancer, I would encourage you to discuss that with your personal physician. And if it's applicable to you, then it is a good idea to try to find things early, because we can improve prognosis by treating cancers early and hopefully keep people alive.
Yeah, and like you said, treatment options, there's plenty available, but early detection is huge. So how can people stay on top of that best?
Yeah, so through the CT scan screening to find it at an early stage, like stage 1 or stage 2, and your chances of being alive and well long term are much, much better. Lung cancer is a disease where if we wait till we feel symptoms and we're actually starting to get sick from the cancer, oftentimes it's already spread or has very advanced and can be difficult to actually cure at those stages. However, treatments have gotten significantly better, and there are a few of the treatments I'd like to just mention. One is that we are now harnessing the immune system to try to effectively address lung cancer, and in specific people who have signs that the immune system will really help in their cancer's case. We have seen really positive outcomes related to using those medications, and they're very different in terms of side effects than traditional chemotherapies. They're generally more well tolerated. And lastly, we here at Gundersen, we participate in something called the Precision Medicine Molecular Tumor Board, which is a statewide collaborative effort where we review the genetic changes in lung cancer, and we actually look for actionable mutations or targets that we can use to leverage in the patient's best interest, using medications that disrupt those growth pathways. So some exciting things that are definitely available for our patients here at Gundersen, and we're happy to be able to offer those services.
Definitely some great information there. Thank you so much for joining us this morning.
Thank you.